What's up, guys? Okay, so let's talk about time management and some other tips that's going to help you as a new nurse be more comfortable and more confident because you know what you're doing and you got a routine down pat and you basically you're better at anticipating things and stuff like that. Okay, so let's talk. Okay, so it's about 8 months now, I would say. It's probably like 8 months, okay? So I am very comfortable on my unit doing what I'm doing, and I have acquired a lot of skills, and I'm very confident and comfortable in that. And one thing that helped me become more confident and comfortable was not shying away from hard things. Let me give you an example. On our unit, we're a cardiac unit, and now we have been trained in something called aquapheresis. So a lot of us on the unit have been trained in it by way of education on the computer and finishing that education and reading the material, but some of us have never had that kind of patient, so we don't really know what to do. For me, I need to put something into practice before I can actually get it, so I got to put my hands on it. So a lot of nurses, when it's time for that patient to come on the floor, they come on the floor. Now we got to do aquapheresis. A lot of them, start, I never had a patient like that before, and I don't know what to do. I don't want that patient, and and they start giving, the charge nurse grief, and now they got to switch the assignment around because the nurse doesn't want it. Me personally, I welcome it because my mentality is this: I am not alone. I'm not by myself in this thing. I have help. I'm not going at it alone. So if I need help with something, I'm going to say I need help. So before I touch the patient, before I touch the machine, before I do anything, I'm bringing the charge nurse in there with me. We're going to go do this together. Show me what to do and how to do it. Because yes, I did do the education, but do I remember? No. Do we all remember it? No, we do not. After we took the class and did all the education 3 months ago or 2 months ago, whatever, do you really think we remember what to do? No, we don't. So you know what to do. So come on in the room and show me, because when you put your hands on it, it's different than just reading about it and doing a little lesson plan. When you put your hands on it, it sticks for some reason for me, and I'm an expert from that day on. So that's how it works with me. So I welcome new things, because you know what? It's an expectation that you have to take on these patients or take on these particular tasks and skills. Why not begin to perfect them? Don't delay the inevitable, because it's going to happen. That you're going to get another patient, it's going to come around again, and you can't keep refusing it just because you don't know how to do it when it is within your scope of practice. So don't be a scaredy cat. Take it on and just do your best. Know that you have help. All right? So don't be those type of nurses that always refusing because they don't know how to do something. That's very annoying. I wasn't even the charge nurse, and I'm new, and I was getting annoyed. I'm like, come on now. Seriously, what are you here for? Well, you think you're just going to come in and get all the easy patients? No, come on now. So, yeah, don't do that. So that's going to save you time as well, because if you were to get that kind of patient the next time around in the future, now say you have that patient on top of other patients who will have a higher acuity, and you can't give it away. Now what are you going to do? So now if you would have took that patient before and got familiar with what to do, your future assignment could have been a whole lot better, because now you know what to do, so you don't have to waste a lot of time on trying to figure out what to do and trying to find somebody who knows what to do. Because what if that charge nurse or whoever's there, the group that you're working with that night, really don't know what to do? Now you're stuck. Now what? So, take on what you can take on, stop giving stuff away, and just put your big girl panties on and your big boy drawers on and go on and do it, and stop being a scaredy cat. So tip number 1, stop being so scared of stuff. You have help. You're not alone. Number 2, and I hope I get my numbers and stuff, my number 1s and 2s together in an order. Number 2, what's going to help you save time is anticipate stuff. Anticipate it. And for instance, say like you have 4 patients and the most you can get is 5 or 6, and you only have 4. You're getting a new, and there's a lot of empty beds because you've seen it when you walk by to go to the break room where you put your bag and all of that, and you've seen all those empty beds. Anticipate an admission, or even a discharge. At nighttime, we don't really get a lot of discharge. So what we do, we anticipate, and what we do get, we get a lot of admissions, and we do get slammed. So anticipate that and begin to plan your day accordingly. When I'm talking for night shift, so you're going to hear a lot about night shift. So plan it accordingly. Get your stuff out the way. Get that little time-wasting charting out the way. That little stuff that you have to do. And the little busy work charting, get that stuff out the way, and make sure you run in. I'm telling you, this is so important, and this is going to save you a lot of time as well, because don't follow the patterns of other people. You get your own flow and do your own thing and be a responsible nurse. So when you come on, you see a lot of people come on and they just get the report and then they go drink coffee, or they go sit on the computer and they look up information. Okay, you look up information. What I do is, before I even touch the computer, if I didn't come in early to look up the patient, because I usually come in early, but if I didn't get a chance to come in early, after I get report, I go in and I look at my patient. I assess them, especially, okay, so let me put it this way. Those that are walkie-talkies, independent, they don't have a lot going on, they're not critical, I save my assessment. I assess them, I look them up and down, talk to them, make sure, they're alert and they're alive and they're doing okay. But I'm not going to go do the touchy-feely. Right? I do my touchy-feely on those who are not stable, those who can go down really, really quick during the shift, those who have oxygenation problems. If they're COVID patients and all of that, I do my assessment early. After I get my report, we go in together. With COVID patients, we don't, go in the room, because I go in after. We don't need to all be up in there doing all of that. But if it's not a COVID room, we go in there, and I do the head to the ceiling to the floor, and I do my general eye assessment, and then after I get my report from the other nurses, I go back in the room and I do a head to toe on those patients that I feel are not stable and they can go down any second. You want to know the baseline first. And those who are walkie-talkie, don't got nothing going on, getting ready to be discharged tomorrow, they just waiting, for whatever. I do my assessment when I'm passing their meds, or sometimes I just go and do it real quick, But get your assessments out of the way, because you don't want the funk to hit the fan and something to go down and something happens to that patient and you can't give a baseline and you don't know what's wrong with that patient and how they got that way and what they were before. Don't do it to yourself. And then when I go in the room, I have like a whole system. I have my little sticky notes, as I'm doing the assessment, because I don't chart my assessment right then and there, because it takes up too much time. Because I know the longer that you're in the room, the more they find something for you to do, and you don't got time for all of that. So I go and I do my assessment, flush my lines, flush your lines. Flush your lines. Let me tell you early, because you don't want to have 5 antibiotics that you have to give, and this person's in the hard stick. Now you got to go fishing around for somebody to put an IV in, because you can't. Now, you could probably put an IV, you're probably good at IVs, but sometimes patients have those veins that you just can't, and you need professional help. So you gotta now, the IV team is gone for the day, so now you gotta go hunt down somebody from the emergency room to go do it for you, and they can't really because they're busy, so you got to wait until they're done. But then you got all these medications and stuff to give this patient, so make sure your IVs are working with the other nurse. And if it is not working, and then you put that responsibility on them, okay, before you leave you need to go find a way to put an IV in this patient. Make them own it before they step out and give it to you officially, because then it's your baby and it's your problem, and now you got to go, you know, and figure it out and then do all the charting on it. No, that's why you take the other nurse in the room, because you don't got time for the food. You don't do that to them. You don't do that to other nurses. So don't let people do that to you, because they will do it to you. All right? So you make sure you set yourself up for success and not failure, and not for frustration, because nobody got time for all of that. All right? So that's going to save you a lot of time. That's why when people start giving report, okay, we can give report out here, but both of us, we're going in that room and we're going to do the ceiling to the floor. And if y'all don't know what the ceiling to the floor is, I think I mentioned it in my other video. We doing that together. All right? Because you're not going to leave me no junk. And you're not going to leave me with a mess. All right? So that's going to save you a lot of time. And what else is going to save you a lot of time? Those IVs that are beeping because they are in the AC or somewhere retarded, throw another line in, because you don't got time to keep coming in there pressing the button, especially if they're confused, you know, or they have high anxiety problems. You know, those IV poles, them things beep really, really loud. And if it's a confused patient, that thing is going off and just keep going off, they're going to start getting worried, and then they're going to start pulling stuff out, and then you're going to have a bloody mess on top of the IV that you just lost. So just go put another IV in them to save you some grief, and so that the thing can stop beeping, and so that they won't think that they did something wrong, the patient, and try to find a way to jump out of bed because their alarms are beeping. And then you don't want to tick off your good patients when they keep bending their arm, because people are going to bend their arm. It's a natural thing. It's supposed to bend, you know. So, you know, you don't want to tick off your good patients because they keep doing it by accident, but it's in the wrong place. And then when it take you an hour and a half to get in there to actually go fix it, or for somebody to turn it off because you can't get to it, they're already ticked off now because they got this thing beeping in their ear. It is annoying. So just throw another line in. That's a time saver right there, because now you don't have to worry about it anymore. You don't have to, you know, now be distracted and stop what you're doing to keep running up in there to turn off the IV. Just stick a new line in them. What else? Ooh, how am I supposed to get all of those big old boxes in my house? Let me show y'all. Jeez Louise. Let me show y'all this foolishness. It's like 1, 2, 3. That's my entertainment center, y'all. How am I supposed to get that inside the house? It's 12:07. I just came back from a class where in residency class, we have to take so many classes, and it's a part of our program. So I came back from that. So yeah, so what was I saying? Oh yeah, stick a new line in people. Don't be, you know, having them beeping for days, because that's annoying. Oh, I remember I was at one of my old facility, right? And it was at nighttime, and it was a guy from another unit. He's a director now, but I'm telling you, I was a PCT, and the IP was just going and going and going, and no one went to stop it. And you know, as PCTs, we can't touch those IVs. We could just tell the nurse, listen, your IV is beeping. Sometimes they'll say, well, can you just turn it off, whatever, but technically we're not supposed to touch them. So he got so annoyed and mad that he went all the way up. He left his unit, went to our unit. You can hear it from his unit. He went to our unit and went and just gave it to the nurse. Not even the nurse, everybody who was sitting there, about this IV that was going off, that was beeping for about an hour, and he was mad. And it's a shame when somebody from another unit has to come over to tell you that your IV is beeping. Is ridiculous. Okay, so what else I want to tell you guys? Another thing, what you need to do is make friends and stop being stuck up, you guys. All right? Don't be that person. I don't understand. I'm from New York, and I grew up where I grew up. We didn't have these type of attitudes that I'm seeing. I mean, there was attitudes, but this is ridiculous. I mean, at least we spoke. You know, we were taught to, when you walk by somebody, you say good morning. When you sit down next to someone, you say hello. You don't just sit there and act like the person don't exist. I mean, what kind of foolishness is that? I don't know if it's an age thing, and this is because I'm in nursing school. I was with a lot of younger people, so I don't know if it's an age thing, and parents are not teaching their children how to be respectful and how to speak, but it carries on in your workplace. So in nursing school, I noticed all these little attitudes, and I'm like, why are we acting like that? Are we getting ready to fight? What's getting ready to happen? Because I don't understand these attitudes. How am I supposed to respond to this? So these same attitudes, I'm better than you, you're beneath me, I got all this going on, and the stuck up stuff, all these attitudes, that's from nursing school. It's being carried on into the workplace, and now you got this stuck up new nurse that nobody like and nobody want to work with, and everybody's ignoring because you got an attitude. So you are separating yourself from everybody because of your stink dirty attitude. So don't be that person. You need to make all the friends that you can, because you're going to need the help. You're not going to know how to do everything. You learn things in nursing school, you learn the skills, whatever, but you never actually did it on a human being, an actual real person. So you're going to need help, and having an attitude problem is not helping you. So don't do it. Be friendly, be nice. When you walk into a break room, you see a whole bunch of people, hi, my name is, hi, how y'all doing? Don't just walk in there, put your stuff in and walk out. Don't do that, because you're going to need help. You're going to need some friends, because you're going to have a rough night. You're going to have a patient that's going to have 10 antibiotics and heparin running. I don't know. We get heparin and amiodarone and cardizem. You got all of the stuff going on at the same time, and you're going to need more than 2 lines. All right? You're going to pray for a PICC line, but sometimes that's not happening. So you're going to need people to help you, because all the lines have blown because of all of the Vanco that's going through. But they need that separate line for the heparin. Can't put anything else in that arm, so you're going to have 10 IVs going. Oh, Jesus, up this arm. And you're going to need help getting that, because you probably can't get it yourself. All right, so don't do it. Don't have attitude problem. Another thing that helped me is lists. Make lists. I make lists and I check them off. One chart Foley called chart doctor conversation. I write them down as I go. And with my wow or cow, whatever you call it, we call it a wow. At another place we call it a cow. I take my computer on wheels and I bring it in my room with me, because I need to have my brain with me, and I need to have my sticky notes. I put my sticky notes when I go to COVID rooms. I have all the rooms, because I'm not bringing nothing in that room. It's just the sticky note and the pen. And I write down what I need to write down about that patient. And then I hardly use my brain when I'm in COVID rooms, because I try to not touch anything. Realistically, you're supposed to have a computer in that room, but we don't, because it's not enough computers to go along with every room that has a COVID patient in it, because it's so many. Okay? The same with isolation rooms. Isolation rooms, you're supposed to have the computer in there. We cannot, because we don't have enough computers for it. So make your lists and chart as you go. Chart however you can chart it. If you can chart on your phone, chart on your phone. Do what you need to do, but get the charting out the way, because that's going to save you a lot of time, especially at the end, because after the shift that you had, you don't want to be staying behind charting for 2 hours. this chart as you go if you can. If you can't as you go, make your list and make sure you check off everything on your list that you need to chart. Another thing what you can do is start knocking stuff out early. I don't know if I mentioned that. Knock things out early, especially medications. If you have a person who have 9 o'clock medications and that's all they have, you know you're going to prioritize in. If you don't have any other pressing situation, no one has any antibiotics or anything like that, or a timely medication that has to be given, you want to bust that out as quickly. All your easy patients, you want to bust that out first and get them over with, because it's not fair if you have to go spend 3 hours in one patient's room and the only thing you got to give is Eliquis to this one patient. Knock those little things out. You can start where I work, we can start giving medications an hour early. So medications start at 9 o'clock, we can start at 8 o'clock. So start knocking your independents and your people who don't have, insulin to give and antibiotics and all that stuff. Knock those people out first if you don't have any pressing problems, and then get them out of the way so they're content. And then you go and then you spend the time that you need to spend with those people who have a lot going on. All right? Because it's just not fair for them to wait, and you're going to be over here for an hour and a half when you could have just knocked that out. So knock that out. That's where prioritization come in. You don't have to have people wait if they don't have to wait, and just get that out of the way. Also, what else that can help you? Yes, report. You know what, when I first started, as a nurse, because as a tech, it was the same thing. So it's the same thing, basically. Just give me what I need to know. Don't go off into a tangent. And I noticed that with nurses too. As a nurse, because of what we learned in nursing school, I was highly impressed with nurses giving me an in-depth, thorough report. I know exactly what happened in an ICU 15 days ago, and I know what happened to their mother, brother, sister, aunt, uncle. I know everything. Now it's like, please don't. Just don't. Just give me, are they alert and oriented? How do they take their meds? Is it an applesauce? Can they swallow? Can they ambulate? Where's their IV? Where's their diet? Are they NPO? What kind of tests are they going for? What kind of tests did they have today? And what am I supposed to do with that? Does the doctor know? Do I have to call him back with the results? Did you do it? What did you do? What didn't you do? I just need to know what I need to do for this patient right now. How do I take care of them right now in this moment? I don't need backstory. Don't give it to me, please. Okay, I don't care if they had diverticulitis 10 years ago. I don't care. Don't give me that information, because it doesn't really matter. At this point, it doesn't matter. I just need to know the information right now. How am I supposed to help them during this shift? Is that going to help me during the shift? I don't care what happened to them in the ICU. How is that going to help me right now? So, and when I see that a nurse is going off in a tangent with the history and what happened, I cut them off and I start to lead the report. Where's the IVs? Their skin intact? What's the plan? What are we doing for them now? Are they waiting to be placed? Are they going for a cardiac cath tomorrow? What's happening? What's the deal? Are we just waiting for them to bridge with the heparin? What are we doing? You can keep all that other stuff, because give me 3 minutes the most in report, and let's go see the patient, and then I do my ceiling to the floor, and then let's go. Within 5 minutes, I have report on my patients, because I am learning that all of that stuff that I thought that mattered, becoming a new nurse and being new, it is a waste of time. I don't care. And you have some nurses who like to give that information. I appreciate it, but I don't have time for it, and I basically really can look it up. And if I really do care about what happened 7 days ago and I'm bored, then I'll go find out. But other than that, I don't care. Is that mean? No, I don't think it is. It's just, come on now. What else? I think that's it, guys. That's it. That's all I can think of. I'm tired. I'm gonna go and try to get these boxes in this house. If I go like that and it don't move, I'm just gonna be like, you know what, Greg, you need to come. And this box is waiting for you, boo-boo. Oh, when my son come home, maybe he can help me. And my daughter. When they come home at like 2:30, because it's like 12, maybe 1. It's 12, almost 12:30. Yeah, because that's a lot right there. I'm so happy. Okay, I've been waiting for this stupid. And you know, I had to beg my husband. I'm like, listen, we need a whole entertainment center because I want it to look pretty. You know, we got this big old giant TV and it's just sitting here. Come on now, we need to pretty this area up. He was like, I'm not spending $1,000 on. No, that's just too much money. But you can buy 3 electronic scooters that added up to about that much, and those kids don't even ride those scooters. So you mean to tell me I can't have my wall unit for my house that I want to look nice, but you can buy stupid scooters, those stupid electronic stupid things? No, sir. So I got my wall unit. Okay, talk to you guys later. Bye.